Lymphocytes. There are two types of lymphocytes, large and small, having almost similar structure. So here the morphological features of lymphocytes are: the diameter of the large lymphocytes varies from 12 to 16 micrometers and small lymphocytes from 7 to 10 micrometers. The lymphocytes have a large, round and single nucleus which almost completely fills the cell. It stains blue very deeply, giving ink spot appearance. And the nuclear chromatin is clumped as well as shapeless. And the cytoplasm is scanty because majority is occupied by the nucleus, and its amount is always less than that of the nucleus. The cytoplasm is seen as a clear light blue color around the nucleus, and the cytoplasm does not contain any visible granules. And these lymphocytes have functional subtypes based on their developmental background, lifespan and functions. The small lymphocytes are classified into three subtypes: B lymphocytes, T lymphocytes as well as natural killer cells. The B lymphocytes, which are processed in the bone marrow and concerned with the humoral immunity, but whereas the T lymphocytes, which are processed in the thymus and concerned with the cellular immunity. And the natural killer cells are lymphocyte-like cells that non-specifically kill any cell that is coated with immunoglobulin G, that is IgG. This phenomena is called as antigen-dependent cell-mediated cytotoxicity. That's the reason the natural killer cells provide innate immunity, and the natural killer cells lack identifying surface markers. What about the functions of lymphocytes? Lymphocytes play an important role in immunity, whereas B lymphocytes as well as their derivatives, that is plasma cells, are responsible for the development of humoral immunity, also called as antibody mediated immunity. But whereas T lymphocytes are the one which are responsible for the development of cellular immunity and also called as cell mediated immunity or T cell immunity. This is what is about the functions of lymphocytes. And what about variations in counts of lymphocytes? Here, first let us talk about lymphocytosis. Lymphocytosis means increase in lymphocyte count, where the absolute lymphocyte count is greater than 4,000 per microliter. And the causes of lymphocytosis are physiological and pathological. Physiological causes include, example like in healthy infants as well as in young children, the lymphocyte count is usually high, that is approximately about 60% in DLC, but whereas the TLC is normal, that is relative lymphocytosis. But in females, that is during menstruation, lymphocytes are increased, and this is what is physiological lymphocytosis. And the pathological causes of lymphocytosis includes chronic infections like tuberculosis, hepatitis and whooping cough, viral infections like chickenpox, autoimmune disease like thyrotoxicosis, and especially in lymphocytic leukemia, it is the most common cause of lymphocytosis, where the absolute lymphocyte count is greater than 10,000 per microliter. This is what is about lymphocytosis. And what is lymphopenia? Lymphopenia or lymphocytopenia means decrease in the lymphocyte count, where the absolute lymphocyte count is less than 1500 microliter. The causes of lymphopenia are the patients who are under corticosteroid as well as immunosuppressive therapy, hypoplastic bone marrow, and widespread irradiation, and the patients with acquired immunodeficiency syndrome. In all these conditions where absolute lymphocyte count is decreased, called as lymphopenia. And this is what is about physiology of lymphocytes.